Hello, good morning, good afternoon, everyone. Today, I just want to talk about our next topic, that is the causes of having behavioral issues, disorders in a patient with dementia. There can be the people with dementia doesn't have behavioral problems just because they want to, just because they want to disturb you or they want to cause a problem. They have that kind of ambulations, wandering, opening the doors, coming, doing something, breaking something, pushing, getting angry, or getting just idle without doing anything, or crying, anxious, worried, repeating the same thing, and or calling you without stopping. It keeps on calling you, following you everywhere. All those symptoms, those are uh, manifested because of a reason. There's always a reason. So today I just want to say, I just want to tell you about the probable reasons that they can have, why they have those kind of behaviors. So these people usually, these kind of behaviors can come in a people in a person with dementia, early stage of dementia. Yes, of course, but it's not that, when they are in early stage of dementia, it's easier to let them, to make them understand about their behavior, or to calm them down, because their brain is not that damaged, so they can understand you easily. But in the middle stage and the advanced stage, it's a bit difficult, more difficult, because their brain cannot treat the information anymore. But even if you try to explain to them, even if you try to tell them not to do that anymore, or you want to explain to them their behavior, they won't understand why you are telling them. So that will, the more you try to stop them, the more their anxiety will grow, and there will be a moment where it's you who is going to be very tired. It's you who is going to be very angry. So it's you who is going to be, who is going to suffer. So it's important to know why they behave that way. So what I do in my workplace is I always try to, before, if I see someone, getting angry, or crying, or anxious, always following me, I try to find out why they are doing that. Why? What is the reason? There must be something that provoked, that behavioral disorders. So I come to them, of course, like I have said, accompanying them, dealing with these dementia people. You need patience. That luckily God gave me that quality. I have lots and lots of patience. So most of the time in my workplace, that is the reason that I can calm almost all of my patients that I come across. So most of the time, when not everyone is born with that, that kind of patience. So me, I have that patience. So I some of my colleagues, they get, at first they have patience, but there's a time when they lose their patience and they just give up. So that's why it's very difficult to calm them down. So the first thing I do is asking myself, why are they angry? Why are they having this kind of behaviors? So I try to search, I try to find out why they have this. So I just want to say the causes, the probable causes of behavioral disorders. So the first thing is they might be hungry. Especially in the middle stage, at least they can say, even if they cannot say hungry, they can, keep on if they see something, they put in your mouth, like children. They see the papers, or they see one ball like that, they put it in your mouth. It's a sign of hungry. So, or they keep on searching like that, it's a sign of hungry. They might be hungry, but they didn't know how to say, they don't know how to say they're hungry. They might be thirsty, or they might be having pain, headache. Even when we're having pain, it disturbs us a lot. We get irritated, we get restless, and all. So they might be having pain. You just observe for the sign of pains, or you ask them slowly, like I've said, in a word, very very simple word. Say, do you have pain? you know, those kind of things. Pain, if they can't say yes, if they can say, they can say yes, even if it's a word, they can say with your head yes if they have pain. No, I usually ask the questions yes or no. I don't ask them the questions that needs a long explanations. I just ask them, do you have pain? Or if they say yes, in your head, in your in your back, your hand, your knee, your leg, because at this age usually they usually have you know, arthritis, so they usually have pain in the joints, you know, joints, or they might be having headache, especially headache, or sometimes when they don't sleep well at night. They don't sleep because at night, you know, for them, they don't know, they are lost in time and space, so they don't know that it's night, so their mind is just awake, you know, they can walk the whole night. So because of tiredness, they can be very cranky, they can be very restless. So that might, it might be because of that. It might be because of ignored. They wanted to talk to you, but you didn't see them, or you just didn't have time to talk to them, and you just pass by without talking to them, so they feel ignored. They lost, or it might be also because of low self-esteem. They feel that, you know, they are adults, so they feel that they have to do something. They throughout their life they were busy, they were doing something, they were working, they were doing in their life, they were doing something, and suddenly they don't have anything to do, or they don't know how to do, so they feel useless. So they try to come and be busy with you, talking to you, asking, they wanted to ask you what to do, you know, but you ignore them. That might create anxiety problems. So it might be because of too hot or cold. They feel hot, they can't say that they are hot, or they feel cold, but they can't say, but you can see their signs, their body language, the, you know. But you can, even if you don't know, you just ask them the questions, or you give them sometimes, you know, when they are sometimes from time to time, don't forget to give them to drink, because they don't know how to say they are hungry, or give them something in their hand to eat, you know, to eat, so that they don't get hungry, because they can't say, they can't ask you anymore, like they are like babies, you know, they can't say that they are hungry, but they keep on crying. They keep on crying, or babies becomes cranky when they're hungry, when they're thirsty, when they're not comfortable. So all those things. And also it might be because of stomach problem, no, constipation. They might, maybe they're having a stomach pain, or because, like you see, we are all humans. When we don't go to toilet. Me, I go to toilet every day. If I don't go one day, I feel so restless, I feel so uncomfortable in my body. So in them it can happen, they don't know how to say it, but in that case usually they it keeps on touching about their, you know, their buttocks, their pants, their the lower parts of their body, you know. They keep on searching as if they are searching for the toilets, you know, or they keep on touching their stomach. They become very irritated because of that, they become aggressive because of that, or they don't eat anything because they didn't go to toilet, you know. So it can be because of that, and it can also because of too much noise, or too much light, you know, too bright. It can be because of that. It's not all the time like that, but sometimes when they are tired, when they didn't sleep at night, they want to take rest, but there's so many noise around them, it irritates them, so it can provoke the aggressiveness, or even crying because they can't rest. They just breaks down because they can't support them. They can't tolerate all these noises anymore, people around them. So they just need a calm, quiet, calm time, calm place to just take rest. So it might be because of that they have behavioral problems. It might be because of new faces, because new faces, they don't know, they feel threatened, you know, or some kind of jest, you know, our just brusque, brutal jest. They feel threatened, you know, they are afraid because of fear. They are afraid of something, you know. And like I have said, they are like in nightmares. They don't go out of that because of their delusional ideas, you know, thoughts in their mind, that something is happening in their mind, and some danger, or maybe you know, some in their mind they might be thinking that they are in danger, or someone stole their clothes, their belongings, all those things, you know, suspicion, all those things. It creates uncomfortable in mind in their in them. So those kind of things can create can produce behavioral issues. It can also because of they wants to go to toilet, they wants to go and do urinate, they wants to go and pee, maybe because of that. But they since they are ashamed, they don't have the courage to tell you that they want to go and pee, or they don't have the words anymore to tell you that they want to go and pee. So they get agitated because of that. It might be because of um, because of being alone, feeling alone, you know. We are social animal. We humans are social animal. We need people to stay with us. We need people to interact. We need to interact with people. So they are so afraid that they will be abandoned. They will be, you know, there will be solitudes. They are afraid of that, and especially usually those kind of people are more anxious with those kind of because of those things, because of being afraid of being so alone or abandoned. Usually they have a life history in their life, in their childhood. If the parents, they didn't care for them or they abandoned them, usually that continues even in the adult life. So it's worse when they have dementia. So where if they are orphan, or if they have been abandoned by their family or orphanage, you know, they are afraid that the people will leave them, people will abandon them. So it can be because of that, or maybe also because of they feel shy, ashamed because of something that came to my mind, and then that came to their mind, sorry, and they are ashamed. It might be because of that. All you need to do is reassure them, stay with them, stay positive with them, always praise them for what they do. Like I've said in my golden rules, everything is written, everything, all those that I have talked about in my previous video, all those things, you can use it to calm them down in all these kind of behavioral issues. So it can be because of they are feeling bored, you know. Those, like I have said, they are adults. They were always busy. They were always doing something in their life, you know. Like me, I'm working. I cannot, like, if one day I have to stop working, I'll be feeling bored. Now, while working, I want to stay at home, but I know that if I have to stop working and have to do only YouTube, you know, I'll be feeling so bored. I need to work. I always worked in my life. The moment I got my degree, I always worked. So I need to work. So there might be that kind of people, you know, who needs to work, who always work in the field or working in a office and all. So they need to work. They get bored. So it might be because of feeling bored. They becomes, you know, restless, agitated, and those things. Or it might be because of um, maybe you were not around, but they were just walking around and some other people scolded them. So they get offended. Might be because of that too. But sometimes, you know, it happens to me all the time. Because since you'll be taking care of only your mom, your dad, or your grandparents, only one person, that's all. Me, I'm taking care of 14%, like that. So sometimes when I'm with one person trying to calm them down, backside of me, they fights, you know. There are conflicts between them. So when I comes back, there's a, you know, behavioral problems everywhere among them, because they're crying, they're shouting, and all those things. So I have to take one by one, calm them down. So that's what I do. Sometimes it's very tiresome, but I am so happy when I am able to calm them down. I do that. So it can be because of uh, empathy, because I have said people with dementia, they are emotionally very intact. They are emotionally intact. They are very sensitive. So if they see someone suffering, some people, you know, crying, babies crying, they will cry. If they see someone hurt or someone unable to walk, someone suffering, you know, they will take that, even that one, they will take it, and they will feel themselves that same feelings that other people are, the other person is feeling, having. So they will take all their emotions of those people around them, and they will feel, and they will have that restlessness, crying, or agitated, walking around, because they don't know how to calm that feelings that they have in them. So that it can be because of that. So like I've said, so all those you know, there can be more. So it depends according to their lifestyles, according to how the cultures are. So it might be according to the beliefs and all. It can also affect the behavioral problems. If, for example, if they have the habits of every morning they have the habits of praying in a certain way, in certain manner, and they don't do that in their mind, no, they still have that, you know, needs to do, but they didn't do it, so that can create uneasiness in them. So so those can be the reasons why they have this kind of behavioral problems. The first thing you have to do is, the moment they have that kind of problems, the first thing you have to do is just try to find. Of course, I'm not saying that you are going to find exactly why the cause of that behavioral issues, but at least try to ask them, are you having pain? Are you hungry? Are you thirsty? Do you want to go something? Do you want to do that? Sometimes just give them something to do, you know. Or if there's pain, you just give them, maybe you can consult the doctor, or for the medicine, for painkiller. So painkiller, sometimes we cannot calm them down. What we do in my dementia area, my dementia sector where I work, is pain we do with medicine, and all the behavioral issues I try to do with my own technique, with the golden rules that I have talked about. So most of the time, you know, most of the time they don't need medicine. I try to calm them down, but since it's a you know, it's a kind of so many people around, so me myself alone, sometimes it's very difficult to calm them down. And my colleagues are there, but they are not in that position. They are not in my job. I am the only one who works as a in this post, in this job. So they try to help, but they don't have that, you know, that I say the qualities. I'm not saying they know how to work, but that patience, or the way they talk, you know, that they don't have that. So they are finding it very difficult to calm them down. Of course they can, sometimes they can, but they cannot calm them. So when a person is so aggressive or so sad, you know, it's very difficult for them. Like I have said, even me, I was like that. I've been working here in this sector for more than like almost 11 years, and through 11 years I've been learning how to deal with them, and now I'm finding it more comfortable dealing with those kind of behavioral issues. So I do it every day. I will start working at 9 till 5 p.m. I deal with that the whole day. So the first thing is just try to understand why they are behaving that way, why they are acting the way they are doing, and try to give them something to do. Even if you don't know, if you couldn't find why they are behaving that way, just sit with them, hold your hand, stay with them, or just go for a walk. Just divert their mind. Might be because of anxiety in their mind, you know, they think of something. Just try to let them divert their mind, so that they don't think about that one anymore. Just divert their mind. Use their sensorial senses. Use their senses, especially the vision. You know, give them something that they can see, or they can touch, or they can smell, so that they can divert their mind by that objects, by that materials. So try to do that. But I will talk to you about that little by little, topic by topic, how to deal with those each the behavioral problems. So that's all for today. Thank you so much for watching. I hope I'm helping you. I hope my videos are helping you understanding a little bit about dementia and how to deal with them. So I'm not like you have one of you have mentioned, have commented that they are like eggshell. Yes, they are very, very fragile. But yes, it's very difficult to take care of them. That is a reason why the families who takes care of them suffers a lot, because you are dealing with a person very sensitive. Anything you do, it impacts them, it affects them. So if you don't do well, they becomes more angry or more anxious, you know, and it goes crescendo, it goes up. And the more you try to do things, if it's not in the right way, it increases their anxiety. And when they increases your anxiety will go up, and your anxiety will push, their anxiety will go up too, and it goes until it explodes, until you break down. You can't do, you just cry. I met so many families, the day they bring their parents or their grandparents to my sector, to our health center, they cry. They said, we can't anymore. They try to keep them in their home, in their house, as long as possible. But they bring to our sector when they couldn't tolerate anymore, when they couldn't deal with that anymore. And, they comes and they said, at last we can sleep. They say like that. They suffers a lot, a lot, a lot, a lot. They cry in our arms. We take them, we cuddle them, we just hug them to support them. We just tell them we are there to help them, that they can take rest, that they don't need to come and visit them for the moment, that give them the space. We tell them to take rest as much as they want, that we are taking care of their parents. That's what we tell them, reassure their family. And sometimes, what happened? When it's a couple, when the wife is having dementia and the husband is the old person, husband is taking care of his wife. There was a case like that. So many cases, not only one, but just one example. He was taking, what happened was that his wife was, they were having two sons. And the two sons, the younger son died at the age of 25 because of in an accident, car accident. Okay, so that affected them so much. Okay, their mom, that woman, she was affected. Okay, but they still have one son. They were living their life, and at the age of 45, that older son died of cardiac arrest. Again, the second son, he died. The mother never came out of that traumatism. She had dementia because of that, shock that she had. She never came out of that. And she stayed in that denial mode, and she destroyed her brain. Her brain was destroyed because of that incident. She stays negative, sad, all the time. So she became dementia. And it was her husband who was taking care of her. And he was taking care of her all that years, I think 10, 15 years, 10 years, 15 years, yes. Or even 20 years, I don't know. But he was taking care of her. But at last, he was suffering so much. He couldn't anymore because he was also aging like his wife. So he couldn't anymore. Finally, he decided to bring his wife to our healthcare center, and he brought him. And at last, finally, he could take rest. And what happened was that he knew that his wife was in security. He knew that his wife is already in good hand. The next time he went back, he just visited his wife once or twice. After that, he died. He expired. He didn't get the time to recover from his sufferings, from his tiredness, because he took care of his wife so much. He suffered a lot. He was bearing all the behavioral disorders. He was trying to deal by himself, trying to manage the behavioral disorders of his wife alone all these years. And the moment he knew that his wife is already in security, is in comfortable center, that she's going to be in a good hand, he just respired. He just breathed after that he died. And that was not the only case we had. We had so many cases like that, especially when it's an old couple. And the children, of course, they bring their parents and they cry. They cry because they were just breaking down. They were breaking down. And they cry also because they were having guilty feelings because they have to give it to someone. They are not, it's their mom, it's their parents. Like every one of us, we want to take care of our parents, but they couldn't anymore. They couldn't do the role of the children taking care of their parents, but they can't. Having people with dementia and with behavioral disorders, physically they are fine. They are so strong. Sometimes they are very strong. They can just hit you, but their head doesn't go anymore. So it brings sufferings a lot to the family. So that's what I wanted to say. The next topic I'll be talking about, maybe I haven't decided yet, but maybe I'll be talking about how to deal with aggressivity. I'll be talking about that next video. Okay, thank you so much for watching, and I'm hoping that it's reaching to many people, especially people who are having dementia in the family, and also people who wants to know, who are curious to know about this disease, because it's going to be more and more like here in France. Earlier it wasn't diagnosed, it was like that, you know, because as life expectancy was lower, and since people are living longer and longer, so this kind of problems, dementia, Alzheimer problems, is going to be more and more in our society. So usually the Alzheimer disease comes after the age of 65. So usually, if it's not hereditary, if it's hereditary, it can come at the age of 30. But when it's hereditary, when people have Alzheimer's disease at the age of 30, usually they don't live even 5 years. They die they die very soon, because their brains gets damaged faster than the people who are having dementia at older age. So thank you so much for watching. I'm keeping talking and talking. So next topic, next video will be coming. I'll see try to talk about aggressivity. Okay, thank you so much for watching. Bye bye.